Welcome back. I'm Mabel Jong, and you're watching Day 1 coverage of the World Healthcare Congress here in Washington, D.C. And in our studio right now, we have Jeff Micklos, who is Executive Director of the Healthcare Transformation Task Force. Welcome.
Thank you. It's great to be here.
Well, first of all, tell me about the work of the task force.
Sure. The Healthcare Transformation Task Force is a consortium of purchasers, patients, providers, and payers who come together to share the common bond of moving forward toward transformation to value-based care. It's an organization of 42 members. Our providers and our payer members are committed to transitioning 75% of their business arrangements to value-based care by 2020.
Oh, 2020.
And so the Transformation Task Force provides them a forum to share ideas, learnings, best practices, and toolkits to help everyone move forward and transform.
Okay, and so what is the mood of the membership right now about the pace of change?
Well, it's not easy, but we believe our members really are leaders in their energy to move forward. We have members that are at different places on their transformation, but are all working and making the necessary investments to move their organizations forward. So there's a very positive energy around it. There's certainly challenges and opportunities along the way. We help them work through that, but people are all moving in the right direction.
Absolutely. And what do you think some of the biggest challenges are, or what are you hearing from the membership?
Well, I think culture change is an important one. You have to be ready to provide care in a different way and make sure that it's definitely consumer-centered. Patients have a voice in the type of care and type of models that they get care early on, but also sharing of data. Certainly the need of exchange of data between payers and providers and patients is at a level that never has been experienced before, just given the sheer availability of data, but the need to share that information, make sure it's accurate and actionable for patient care to benefit.
Okay, certainly there's been a lot of discussion about data and having the technology to gather that data and then to support it. Are we using resources in the correct way?
Well, I think generally it's moving forward. Sometimes with technology it's 2 steps forward, 1 step back sometimes. I think the organizations themselves are really fortifying their systems to make sure they are a good module that can plug into a larger system. But having how those systems talk to each other across the continuum is still an area of challenge, and issues of connectivity continue to be something that I think industries work for, and we strive for solutions so that organizations can better interact with each other and share data.
Are you seeing, Jeff, a common thread of those that are more successful in hitting that mark of 2020 than other systems? What's the commonality between the membership that is having a lot of success with their changes in their organization?
Well, I think within the task force itself, as well as industry-wide, you see people or organizations at different level of readiness. I think we have a number of organizations that have been providing care in an integrated way for a very long time, have been sharing risk on the finance side for a very long time, and they're just now transitioning themselves to kind of work within the current environment and the different types of payment models that are out there. I think for other organizations that may not be as ready for that, the idea is how do you provide care today to your patients while also making necessary investments to transform yourself for the future. And I think there's different strategies about how that can happen, but they're also very market specific, whether you're urban or rural, and what your patient population is really a significant impact on what your strategy is going forward. And the task force provides people a forum to really share those learnings from different areas, and what has worked, what maybe didn't work, and what did they pivot from to be able to make it work. And that's what our about is sharing learnings among our members. Okay,
terrific. And you have a very busy calendar, I'm sure. Why did you put the World Healthcare Congress on your calendar?
Well, this is an important session to talk about not only transformation generally, but the session that I was part of was really talking about the contracting opportunities, where the rubber meets the road. There's a lot of discussion out there in academia and others in consultancies to talk about the transformation movement. It really, though, it has to happen one arrangement at a time, one market at a time, and some of the sessions that are presented here really talk about the practical realities of moving toward transformation.
Okay, Jeff Micklos, thank you so much for your time today.
My pleasure. Thanks for having me.
And I'm Mabel Jong. Thanks for watching. More to come.